Breed, and I'm an anesthesiologist. The majority of what I do involves getting patients ready for surgery, putting patients to sleep for surgery, and taking care of them while they're asleep during the surgery. Also their immediate care right after the completion of the surgery until they leave the recovery room. There's no direct substitution, but there is such a thing as CRNAs, which are certified registered nurse anesthetists, which are nurses who do extra training specifically in the field of anesthesia. However, they are required to be supervised by an anesthesiologist and are not allowed, at least in the state of Texas, to work without the supervision of an anesthesiologist. Yes, I believe we do accept all forms of insurance. To become a doctor, first of all, you have to have had at least a bachelor's degree, so at least for college and undergraduate work. Then you take the MCAT exam, which is an exam over basic science material. And then you apply to medical school after that, and it's a combination of your transcript of grades from college, your MCAT scores, and an interview process that determines if you get into medical school. Once you get to medical school, it's another 4 years. After you finish those 4 years, you get your MD, so you're a medical doctor at that point. And then after that, you have to complete an internship and residency, which is further training in whichever field, whichever specialty you go into. For example, for me, anesthesia. Some people may do internal medicine, some may do surgery. That process is another anywhere from 4 to 10 years. So you're looking at a minimum of 12 years of education past high school. Along the road through medical school, there's also licensing exams to get your medical license, which is 3 different examinations that you take starting in your 3rd year of medical school, again in your 4th year of medical school, and then after you completed your 1st year of residency. After you finish with residency, then you can become board certified in your specialty, which for anesthesia again requires a written examination, and if you pass that, then there's an oral examination several months later in order to be board certified.